We're going to move on to our third digital innovator in the cohort, Maternity Foundation, and representing Maternity Foundation is Tara Talvacchia.
Great. So hi everyone, I'm Tara Talvacchia. I'm representing the Danish nonprofit Maternity Foundation, and I'm the manager of partnerships and strategy. And I just want to say thanks so much to the conference organizers for making this all work on such short notice. So I'm going to share a little bit about our intervention, which is the Safe Delivery app, by telling a story. And it's not just the story of one person or one healthcare worker, one beneficiary, but actually the story of a place, which I think is in some ways very unique, but also exemplary of some trends we're seeing at national levels in India and at global levels in health. And this is the story of the district of Mewat, which is in Haryana state in north central India. And we were told recently at Maternity Foundation on a visit that this district is 60 kilometers and about 60 years behind New Delhi. And this was something that was said to us by the director of a district hospital there. And Mewat has a very high level, a high portion of its population that are Dalit, the lowest untouchable caste, and a majority Muslim population. Most people there work in agriculture or truck drivers, and access to basic services such as clean water, sanitation, and hygiene are very lacking. And in addition, women have on average 5 children. But at the same time, right, there's a lot of development challenges, obviously, in this district. But there has been a stunning increase in institutional deliveries in Mewat, from about 40% in 2005 to about 70% in 2015. And this trend is actually something that you can see in India at a national level and at a global level as well. And in Mewat and in India, a lot of this is due to the fact that, for example, there's the world's largest conditional cash transfer program, JSY, that drove women in increasing numbers into facilities. So the question then becomes, you know, with this stunning increase in the supply side showing up for care, can those in these clinics and hospitals meet this demand with quality care? And several studies of JSY and other programs that were implemented by the government of India with the intent to drive women into facilities to give birth actually found that there were urgent efforts that were needed to really increase the competence of birth attendants to manage obstetric complications for these women that were showing up for care. So one of the programs that the government of India implemented to try and tackle this quality of care issue was called Laksha. And Laksha has several components, but the one that the Safe Delivery app fits into is this enhancing the knowledge and skills of staff to provide quality intrapartum and intermediate postpartum care, as well as the timely management of complications and appropriate referral management. So in comes the Safe Delivery app. So the Safe Delivery app is a free app for smartphones or tablets that provides skilled birth attendants. So this varies a little bit country to country, but these are trained medical professionals, normally midwives, nurse midwives. They can be doctors in some cases, but they're trained medical professionals with instant access to evidence-based clinical guidelines on basic emergency obstetric and neonatal care, as well as a selection of essential preventative protocols. And the app was developed by Maternity Foundation together with 2 different universities from Denmark, where we're headquartered, and launched in 2015. And the idea for the Safe Delivery app was born out of our on-the-ground, fairly traditional NGO that was operating in Ethiopia that was focused on training healthcare workers and how to handle emergencies. And we saw a real gap and a real need for a tool that could take these guidelines and make them simple, easy to understand, highly illustrated for low literacy settings, but also in addition to just being used in training, that could be something that was easily accessible at the fingertips of skilled birth attendants when emergencies did arise. So the app contains videos, action cards, practical procedures, a drug list, and My Learning, which is an interactive learning platform that allows users to go on a self-guided learning journey based on what they know, what they don't know, what they want to brush up on, and eventually earn a certificate that they've passed all levels at the desired level of proficiency. So the app is used in a variety of settings. It's used in the health facility. It can be used in pre-service education, so at midwifery, colleges or nursing universities. It can be used in-service refresher training, and it can be used in facility-based mentorship programs like Laksha. And I think I mentioned already, it's used as a job aid. Skilled birth attendants use it to review and refresh their knowledge, to look up dosages while they're on the job, if they have time. As a study aid, it helps support in simulation drills, but also in the classroom, so in practical settings and in hands-on settings. It's also a teaching tool. We've heard from a lot of teachers and mentors that the app actually helps them break out of delivering slide after slide after slide, and allows them to change their teaching methodology a little bit to be more hands-on and more engaging. And also it's used, as I mentioned before, as a self-directed learning tool. So back to Mewat. What have we seen so far in Mewat? What has been the impact of the Safe Delivery app there? So we've heard that, you know, nurses are much more confident now. They know how to stabilize patients. And actually there's been a change in the number of patients who've had to have been referred from clinics to the hospital level. The nurses actually work more according to protocol now. We've heard this in a number of settings. There's a lot of disagreement just because of the way trainings are administered, but also time passes and people forget what to do in emergency situations. So there's often a lot of disagreement and deviation from protocol. And we found that the Safe Delivery app helps adherence to protocol. And then we've heard from the nurses at the primary health center there that their degree of knowledge has increased. They really talked a lot about infection prevention in particular as a subject that they brushed up on, which is a huge concern when you have a ton of patients coming in all of a sudden to your facility. Infection prevention is a huge issue. That they also confirm at this level that the nurses feel that they're able to refer less and stabilize patients better before referring them, and that they have something to guide them when they don't remember a drug dosage or how to handle a particular case. So in addition to this qualitative data, you know, what else can we see? You know, this is all fabulous, but the great news is we can look into the back end of the app, and we have a data dashboard that pulls data from the Safe Delivery app. And so we can see what is engaging users in terms of content, in terms of feature, and we can see the development in app usage over time. And for example, in the case of Mewat, there's 53% of users are highly active. So that means we've set specific metrics in the amount of time that users are spending on the app and in the number of features. So we can, in this way, see a lot of what we've heard qualitatively matches up what we can see quantitatively. We can also see learning progress and gaps in competencies. So this actually, they're kind of small, but the charts below show the average user journey through My Learning, content and levels in Mewat. And so together with the qualitative data, we can start to generate insights in what healthcare workers in Mewat, for example, know, what they don't know, what they're striving to get better at, and feed that back into decision makers in training and learning. So zooming back out of Mewat, we have a huge champion in India who is Dr. Dinesh Baswal, is the Deputy Commissioner for Maternal and Newborn Health at the national level. And he's the one that reached out to Maternity Foundation and said, we want the Safe Delivery app in India. And we worked very closely with him and his government in Topigo to create the app for India. And since then, we've seen about 65,000 downloads in 10 states since 2017 when the app was launched in December of that year. But in addition, I think Dr. Baswal's point about the stickiness of the app, how busy people are, the stress in the labor rooms, but that once people are on the app and are learning on the app, they're hooked. So panning out a little bit more, our global impact, the case of Mewat, I think, is pretty exemplary of of how the app is adding value to quality improvement efforts in maternal and newborn health around the world. We have 20 plus implementing partners in 15 countries, over 130,000 downloads. We have over 12 different versions of the Safe Delivery app. You just saw the one for India, but our impact is much broader than just what I've highlighted here in Mewat. And finally, where are we headed? So Maternity Foundation, I think I mentioned at the beginning, started as an on-the-ground NGO in Ethiopia, really focused on training. And since then, we've taken that into the space of digital training and digital learning. And we've seen that this is a really niche space in digital health. There's not a lot, it seems, not a lot of apps that are focused really deeply on learning, and not a lot of organizations that are bringing together both digital learning and in-person learning to bring about blended learning. So we're trying to figure out how we go beyond the Safe Delivery app to look at adult learning more broadly in this space. And I welcome suggestions and questions in that regard and about anything else. Thank you so much.
Great. Thank you, Tara. We have a few questions from the audience. One is the app available in Urdu for use?
No, not yet. No, not yet in Urdu. But we have a strong clinical team that is open to exploring different language versions and can speak with whoever is interested.
Gotcha. Another question is, do you have any license or accreditation to offer health education? Or do you need any?
Yeah. So some of the organizations that we work with do. So for example, in Ethiopia, we work very closely with the Ethiopian Midwives Association. And they, together with the Ministry of Health there, have used the Safe Delivery. The Safe Delivery app is part of the official in-service basic emergency obstetric and neonatal care training program for all midwives in the country. And that program is accredited and the Safe Delivery app is embedded into that, but we haven't yet had to do that ourselves. Our partners, such as the Ethiopian Midwives Association, they handle that kind of thing.
Outstanding. Question about objective evidence. Do you have any objective evidence healthcare outcomes with maternity?
Yeah, so we haven't gone to healthcare outcomes yet for a few reasons. So I think on the previous slide, you saw that we've conducted 2 different RCTs, one in Ethiopia, and we had a partner do one in DRC. And those focused on improvements in skills and knowledge and confidence of skilled birth attendants, which is really our the primary outcome that we're focused on. It's a bit of a leap to say that it's hard, right, to prove that skills and knowledge and confidence have an impact on health outcomes. I think the next level of research that we're really interested in is implementation science. How does the Safe Delivery app impact those things in a non-controlled setting, and how does it add value in these large-scale quality improvement programs? I think the health outcomes, if we're going to look at mortality and morbidity, it's pretty tricky to make that leap, but open to exploring it in the long term. Outstanding.
Well, I'm afraid we've run out of time for additional questions. Tara, if it's all right, we might email those questions onto you, and you can answer them directly. But thank you so much. So